First, definitely is medical imaging. So you people are very much familiar about the medical imaging. This is a technique or process like we take in, you can say capture interior of the body for the clinical analysis and the medical intervention. And I know all of us, like you can say, many times has gone through for multiple imaging, and we have experienced a lot of, you can say, modalities in hospitals and etc. So there are many types of medical images. You people are very familiar. So for example, radiography. So it depends like what techniques they are using, and the purpose, and their medical imaging are being used in diagnostic purpose. They are being used in treatment planning or surgery planning, or you can say health analytics. So there are multi-purposes of this medical imaging. And radiography, like where they use the X-ray techniques to capture the internal organs on the digitally, or some in the remote areas where they have the traditional and the old technologies. They are using typical films there. MR images, they use magnetic field. Ultrasound, you use a sound frequency which is beyond the human limitation. And so these are like endoscopy, like internal hollow, and they take through camera. So these are the different medical images, and currently like being used in healthcare industry in Pakistan and globally. So if you talk about the medical market, this is so big. Like even it, as per stats, 2019, 36 billion market it was total in the US dollar, and its annual growth rate is like 2026 5.8. Which is quite very high. There's a lot of scope, and there are a lot of companies coming in this domain. I will share like few good names, and one of them definitely like sitting among us. It's honor for us. And so before moving forward, so particularly I will go towards the challenge. Like what are the challenges in currently in healthcare? Like I know is because ultimately healthcare is very vast field, and no one can be expert in everything in it. So we feel like from the beginning we have been working in the artificial intelligence and the radiology and the bioinformatics. So I'm just taking this whole communication, this whole talk in those directions. So first, definitely, medical imaging, and medical imaging, like you can say, we capture medical imaging when the radiologist reads there. So before understanding that, and if you want to jump in this domain, so you must be very familiar with the radiology workflow. So I will superficially, I will introduce like what radiology workflow is. So basically, patient information comes from the radiology information system, which is connected with the EMR. Then a modality, it may be CT, MR, or FFDM. So any like modality which takes medical image, the modality will take, patient will come, they will take the medical image. That medical image will be stored in the DICOM format, that will be sent to the centralized archive. We call it picture archiving and communication system. So it will be stored there. So when radiologists will come on their workstation, so they will have access of all modalities through central database, which is called PAG. So they will be able to fetch data, and you can say report, and they can write the report, and they can store. So that will be again stored in the PAGs and risk system. So like in the future, if they want to re-evaluate any patient, so they can fetch the previous reports, previous data, and they can analyze that. So this is the conventional method. So conventionally, when they read with the naked eye, and like with the naked eye, like and they mark, you can say they make their surgery plan, you can say diagnose, they write the report, and etc. So non-invasive, this medical imaging saves millions of lives each year, because doctors can definitely detect and diagnose from cancer and appendix to cardiovascular, cardiac disease, and stroke, etc. So images is the large data source of data in the healthcare, and sometimes, and this is the most challenging field for the diagnosis, for the detection, of the disease sometimes, because still human eye always have limitations, and medical imaging still like they have a lot of limitations. So just because of these limitations, and human body and architecture is so complicated, and just because of these limitations, still the misdiagnosis and overdiagnosis rate is very high. And definitely, like currently, when radiologists, when physicians, you can say, has to rely on the medical report read by the overworked radiologist, and sometimes a physician and clinicians, they read the medical image themselves to just to make the decision, just to go for the second opinion. And it was technically, if I statistically, if I talk about, like one out of four medical imaging images or patients, they are, or radiology, like the radiologist, one out of four, they read false positive. And this false positive definitely cause unnecessary and painful procedures. And definitely this adds a lot of cost to the patient, and this adds a lot of stress to the patient. And on the other hand, false negative rates are still very high. And you can say patients definitely, false positive rates the biggest problem. And like sometimes they miss, of course they miss the case, and definitely missing the case impact the devastating effect in the future. Because if patient is, for example, having some cancer, and it's missed by the radiologist, and it progress, and in the future it's, you can spread, you can say, across the different regions, and definitely that's the most devastating and the most harmful. So these are the different challenges currently, radiology, or you can say healthcare industry is facing. And patient, particularly patient, that is impacting their financially, is impacting they're compromising their health, they're compromising their lives. So here, the CAD systems comes in. So that's why, like CAD, mostly CAD system are generally computer aided diagnostics. So there's a belief, maybe these CAD systems are coming to replace the radiologist, to replace the practitioners, and which I believe not true. Maybe I'm the advocate and for the CAD system. Maybe that's why I'm saying, like CAD system definitely use advanced image processing, advanced artificial intelligence algorithms. CAD system reads with the naked, you can say, on the pixel level. They find very complicated patterns from the pixel, so they can better, you can say, analyze the pixel on the pixel level. Because after like 3.5 or 4 year research, we found definitely in the medical imaging, sometimes visually we can't find much different, but when we go in the pixel, so through the some formulas we find some patterns. And these patterns within human eye, which is impossible to identify those patterns. So through image processing, through AI, so we develop the CAD systems. These CAD systems globally, from decade, they are serving the health industry, they are improving. And definitely the CAD, this particularly the global artificial intelligence diagnosis, the CAD system market is 288 million in like 2019, which is projected like during 2027 with annual growth rate is 32.3 million. So this is a massive adaptation toward the artificial intelligence, and the particularly the way this is impacting the, you can say, population pressure globally, because where we have very limited facilities, where we have very limited expert radiologists. So definitely we need assistance just to just to increase the accuracy, and you can say reduce the reading time, and definitely to make the flow more better and saves life. So that's why we are this is the right era, this is the right time for adaptation for the CAD system. And luckily hundreds of companies, they are coming, they are using artificial intelligence image processing on the different medical imaging, and they are particularly they are specializing in a particular field. This is a very simple slide, so you can see here I'm just trying to you can say demonstrate how artificial intelligence work, particularly for those who are not, you can say, very pro in AI. So this is overview. So for example, if we look in this dog. So visually this looks like a dog to us, but the computer reads this with this in the form of pixels, in the form of numbers. So actually when we train our AI model, so currently we train over layers, input layers and over hidden layers in the neural network layers with the dog and with the cats, so with the label data. So actually we train, and the next time when we will give any unseen data to it, so it will go through these layers as per their understanding, as per their previous learning. So output layer will decide either this is dog picture or this is cat picture. So this is the same phenomena is with the medical imaging or in healthcare in CAD system is that. So we are already training over machine learning algorithms, over deep learning algorithms with the already labeled data, which is peer reviewed, which is biopsy proven, and definitely like our systems are learning and becoming more and more proficient. And definitely they learn from the pixels and the patterns that behind the images, pattern behind some abnormal regions. So they're learning based on those patterns. These complicated patterns definitely makes them more vigilant and more efficient in right decision making. So this is how actually AI is working. So uh, there are a lot of advantages of the CAD system currently, like they are serving. Particularly, the very first, and no one can deny, is definitely this can produce results faster. This can you can say diagnose abnormality much faster as compared to the human being, and definitely is more consistent. And then radiologists, for example, it takes almost 15 years for a radiologist being specialist in any domain, for example, in the breast cancer, in the chest X-ray, etc. So definitely we cannot replicate his knowledge. But the good thing is that definitely CAD system in AI model we can replicate, and we can make multiple copies of this learning or this training. Definitely like CAD system are facilitating in decision making and helping where we have inexperienced radiologists. So it helps a lot them making in better decision making. Sometimes like definitely CAD systems automatically improve the radiology workflow, like placing more sensitive cases higher on the radiologist workflow. For example, here I would like to share one use case in a Pakistan. So we are planning to because in remote areas where we don't have facilities, particularly for breast cancer diagnostics. And unfortunately, Pakistan has the highest incident rate in the breast cancer in Asia. And we have the most aggressive form of breast cancer here. Women from 25 to 35, they are suffering from breast cancer in Pakistan. And unfortunately, that's spread very fast. So we are planning to launch with some local partners. So where because in the remote areas there is no facility where a patient can come, they can get the chest X-ray or the breast X-ray, and definitely there are no radiologists there. Even we don't have the basic practitioners there. Even there's no concept of radiologists or experienced radiologists there to serve that in remote areas. So we are planning to launch free mammography campaigns. So where mammography van will visit the remote areas, and they will perform you can say massive free mammography. And like because we don't need radiologists with them, so our system will be installed there. It will triage, and it will definitely like pick up the most sensitive cases, and it will send over the internet to the head office where one or two radiologists will be sitting, and they will be only cross verifying those cases. So in this way, definitely we can run very massive screening breast cancer screening campaign in Pakistan, because it's much needed. And Alhamdulillah, now government, the way like Alexa is working, so government and local stakeholders recognize Alexa as helpful in this campaign. So we are planning on that. After COVID, just COVID is main problem definitely these days. So we launched in last October, and just because of this COVID, so like we had to restrict our movement and restrict our activities. So we are just waiting. Once COVID is, you can say, settle down a little bit, we will go with this practice. Definitely machine have potential to improve diagnosis accuracy dramatically as compared to human being, because most of time as a radiologist, I feel sometimes my mood maybe you can say affect my reporting my decision for the patient. So definitely like this is unbiased. CAD system is always unbiased. Uh, there are a lot of many advantages of the CAD system. So these are the practiced advantages, and definitely like there are a lot of challenges. And initially, like you said, like job security, and this is the biggest challenge I think in adaptation for the AI and adaptation for the CAD system. Not in Pakistan. I think this is a global challenge, but we face a lot in Pakistan, where mostly physician or radiologists they believe if they implement this system, they install this system, this will you can say leave. They will have to leave. They will become jobless. I think like can try to convince them. Although like we have autopilot flights, and mostly like we travel a lot like globally, and mostly like flights go you can say fly in the autopilot mode, and in the cockpit definitely pilots are sitting there just enjoying and taking tea and food, etc. But as a human being, still like we believe as a human, and still we have pilots in the cockpit, definitely just for sake of human satisfaction. So I believe same with radiologists, for the human satisfaction, human can get better satisfaction from a radiologist, from the human being as compared to the machine. So definitely like the devices, the FDA has some solid and some very challenging you can say liabilities on that. So you have to get FDA. So this is in the device 3, which is more difficult than the device 2 procedure. Definitely machine learning, you need a very well labeled data for the accurate labeling of accurate decision making or efficient decision making, and labeling this huge amount of data, and peer review data, and accurate data is one of the big challenge definitely for this domain. Like these are very complicated, you need peer reviews data. So there are a lot of and you have to cover different scenarios. So for example, in the medical imaging, so there is regions, different people, they have different anatomy somehow in the imaging. So you have to also cater different scenarios. You have to train your system on the different scenario. If you train your application, if you train your system on the same scenario, definitely it can work in the some circumstances. In some scenarios, it will cause it may be ineffective against some other scenarios. So here's Alexa come, and I would love to definitely talk a little bit about like the words Alexa and how we are helping not in Pakistan, and how we are motivated to help globally healthcare industry. So before moving forward, and one thing like as in Pakistan, because there is no computer aided diagnostics for the breast cancer has been purchased in any hospital in Pakistan, although we have very well reputed private hospitals and government hospitals already there. And unfortunately, in Pakistan, we lack practiced or experienced dedicated radiologists. And as per need, because mostly radiologists they move abroad, so we have shortage of them. And particularly the third is awareness, because adaptation issue we face a lot of time, because in Pakistan they have not seen such solutions most of time. So there is a education or awareness issue in the healthcare industry in Pakistan. And the fourth, definitely no SOPs or no policy has been established for such solution yet. Although UDRAP and some other institutes, their stakeholders, they're trying to formalize some policies against it, and we are hoping soon this will be here. So there are a lot of challenges, and these challenges definitely makes this best uh, best location for this opportunity, and this brings a lot of opportunities for the companies. They can come with the AI with the different solutions, and they can definitely, and affordability is definitely major challenge in Pakistan. And definitely you have to if you counter these challenges, and this is open market for any player, and that's this we are taking leverage of that, and we will love to share like what actually Zylexa is doing. Actually, Zylexa is a medical imaging company leveraging art of artificial intelligence and helping and offering cloud-based software as a service which helps radiologists in detection, diagnosis, and prediction of the breast cancer and some other diseases as well. So, like in the pipeline currently, like we have launched our breast cancer module, and I will more talk about this. So, this already have been post trials. We are in the post trial stage, and now we are this year we are also going for the FDA as well. Along with that, in a couple of weeks, we are launching our chest X-ray to cover 14 modalities, and along with that, recently we have been awarded grant from Pakistani government just to develop arterial surgery planning algorithms, AI based. They will definitely help uh, surgeons in right decision making and in surgery planning. They will help, and they will increase the accuracy definitely. And we are working with one of the best hospitals here in Pakistan, and best surgeon in Pakistan in a partnership with them. Along with that, like Zylexa is also first multi-omic data R&D center in Pakistan. So we have bioinformatics PhDs, MPhil. So there we are working on the multi-omic data particularly, and our research identify some biological markers on based on those biological markers. So we are training our AI and machine learning algorithms, and particularly we are launching over in a Q3. We are planning to launch our beta application for our multi-omic data for cardiovascular prediction, for Alzheimer prediction, and for diabetes prediction. So, like that's something we will take multi-omic data. When we talk about the multi-omic data, you know, it's your genetics data, it's your physiome data, it's your clinical data, clinicom, etc. So we are taking all these data sets, and we are based on their biological markers. So we are training our AI and ML algorithms. So definitely, like here we are launching our breast cancer. So I will talk a little bit about the breast cancer. I will show you some demo or like how the interface. Actually, like you know, 1 out of 8 women suffer from the breast cancer, and if breast cancer is diagnosed in the early stage, chances of survival 99%. Otherwise, chances of survival 20%, 27% or less, and cure is also very expensive. As per global stats, when radiologist reads the mammograms, and just imagine the number, like 300 million mammograms were performed last year, and more than 30% they are the misdiagnosed. Just imagine the misdiagnosed numbers. These misdiagnosed definitely leads death, and definitely on the other hand, like overdiagnosis that cause a lot of you can say unwanted biopsies and cash burden, financial burden on the patients. So these are the big challenges. So just to overcome these challenges, so we have developed a complete radiology workflow. Our complete radiology workflow actually it is a front-end DICOM viewer, which is with the complete tool sets a conventional radiologist needs for interpretation of any kind of image. And along with that, we also offer cloud packs. So if radiologists, they want a cloud packs and they want to access their data anywhere over the internet. So because this is a cloud-based, so we offer also the cloud packs along with our AI analytics algorithm. So first we launch our breast cancer algorithm. So here you can see, so this is the resultant window. So actually when we upload the studies in our DICOM viewer, actually it automatically when radiology, you can say modality, chest x-ray or breast mammogram performed, it automatically push toward the local packs, that push to our cloud application. Our cloud application will process and will send results to the local packs. When radiologists come, and he opens on the internet, he opens this interface or DICOM viewer, which is a web-based. So he will have access of the results images. The results image exactly mark where abnormalities are present, and if abnormality is a benign, so it turn into green. If it's a malignant, then it turn into red. So along with that, so we are also offering some like density, etc. and risk factor. You can also select the buy rate, and definitely when you radiologist can interpret the results, and he comes to the report, and it can also give the report generation. So this is our first algorithm. So which are currently our accuracy is almost 93%, and now we are this year we are going for the FDA, and now we are working some more features in it. Basically, we have divided our product into two, B2B and B2C. Definitely for B2B, we will be selling to the hospitals. Hospital will take benefit of this application. Radiologists will take benefit of this application. Along with that, we are also working in the B2C because there is a huge market, untapped market. So because when now this is a digital era, and patients, when they go to the hospitals, they get their X-ray, so they get their CD of their images, and they also go for the second opinion. And we actually adopt this idea because after launching our application, so we received a lot of queries from the patient. They sent their images. They said, okay, we need second opinion from your application. So what you suggest, is it the right report, or we should consult third opinion as well. So actually we are also developing a patient portal, and where they can upload their images, so we can guide them. So what next step they should take, and how their medical imaging look like. So we are working on this module, and maybe in 2022 early we may launch. We are hoping to launch over this module as well. Okay, so this is the team behind it, myself, Shahrukh Babar, Shahid Abbasi, and Nida. So we have definitely I have domain expertise. I work in oncology. I served healthcare industry in Pakistan in past. Now my expertise are in AI. Shahid takes care of the operations. Nida, she is already taking care of sales of the German company Image Information System in Pakistan and Middle East. So she has more than 14-15 years experience in selling in the healthcare. Zalexa is in the we have been working for more than 2.5 to 3 years, and we have achieved a lot of we have a lot of achievements. So we have a lot of partnerships, local, international as well, and we also won a lot of awards, local and international as well. So which actually encourage this technology and team. Like we are working in Pakistan, and we aim to serve Pakistan. So that was a little bit about Xilex.